This video is about the male pelvis and the male perineum. I'll talk about some landmarks that you should be comfortable with and you should know. This is the iliac bone, iliac crest here, the sacrum, the sacroiliac joints rather, strengthened by ligaments. These are the abdominal muscles, external, internal, and transversus abdominis. Abdominal aorta, remember at the level of L4, it divides into two common iliac arteries. The one on the right is shown. Here's the external iliac artery along with the same name vein. Here's the internal iliac artery that gives rise to arteries that supply the pelvic viscera. The pelvic viscera in the male pelvis, you can see the bladder anteriorly, that's just behind the pubic symphysis, and the rectum. I'm going to remove these so I can show you the pelvic floor. And here's the prostate. So the pelvic floor consists of two muscles. Here's the pelvic floor from the superior view, and here's the pelvic floor from the inferior view. The pelvic floor consists of two muscles, the levator ani, which is the more important muscle, and the less significant muscle, the coccygeus muscle. So levator ani and the coccygeus make up the pelvic diaphragm or the pelvic floor. Notice you see the beginnings of the sciatic nerve here. And again, these are branches of the internal iliac artery. Here's the inguinal ligament going from the anterior superior iliac spine to the pubic tubercle. Let's look at the posterior view of this pelvis. This is the sacrotuberous ligament. This is the sacrospinous ligament. This muscle is the piriformis, sciatic nerve, and the pudendal nerve. All right, now let's look at other structures that we should be familiar with. This area here is the inguinal canal. This is the superficial inguinal ring. And this is the deep inguinal ring. Through the deep inguinal ring, you can see the ductus deferens, and these are the testicular vessels, testicular artery and vein. Here you can see this structure here. This is the cremaster muscle that's part of or one of the layers of the spermatic cord. This is the external spermatic fascia. These are the pampiniform plexus of veins that are draining the testicle. This is the epididymis, and this is the ductus deferens. And if you look on the inferior view, you can see the perineum. The perineum, this is a diamond-shaped structure that is bordered by the pubic symphysis anteriorly, the coccyx posteriorly, the ischial tuberosities laterally. This is the ischial-anal fossa. This is the anal triangle, and this is the urogenital triangle. So this perineum consists of two triangles, the urogenital triangle and the anal triangle. The urogenital triangle has several muscles that you need to be familiar with. The ischiocavernosus on the side. So here's ischiocavernosus, ischiocavernosus. These are covering bodies that are erectile. This central muscle here is the bulbospongiosus. So ischiocavernosus on the two sides, bulbospongiosus, And then this is the transverse superficial perineal muscle. So transverse superficial perineal muscle. And in the middle, midline, this is the perineal body or the central tendon, where all of these muscles are actually converging upon. And this is the external anal area, and these muscles are converging on the central tendon, and it kind of gives us a strength to these muscles and the urogenital triangle. This is the female pelvic area and the female pelvis and the organs. I'm not going to talk about the structures, ligaments, arteries, and veins that are uniform and the same between sexes, but just want you to know that the organs obviously are different, in addition to the rectum behind here, so posterior part of the pelvic cavity, the rectum, and bladder. In between the two, we have the uterus. So that's the only real difference. Now, in addition to that, if you turn this model and look at it inferiorly, now you can see the perineum, and you can see that basically the muscles again are the same, but they're just smaller. In fact, that's why when we teach the perineum, we usually use a male model or male pictures, because these structures are a little bit more prominent. So here's the perineum. You need to know the borders of the perineum. Anteriorly, the pubic symphysis. The lateral area are the ischial tuberosities. This is the ischiopubic ramus anterolaterally. Posteriorly is the sacrotuberous ligament, and then the very posterior is the coccyx. But then the perineum is divided into two triangles, the urogenital triangle, or short UG triangle, and the anal triangle. And within the anal triangle, you see the external anal sphincter, which is a skeletal muscle. Now, looking inferiorly, you can also see the pelvic diaphragm, but in the cadaver or in life, this area is actually filled with fat, so you really can't see the pelvic diaphragm or the pelvic floor. In the UG triangle, you have ischiocavernosus on the side, bulbospongiosis in the middle, that surrounds the urethra and the vagina in the female. So ischiocavernosus, bulbospongiosis. Then in the midline, you have the transverse superficial perineal muscle. So it's superficial because there's a deep transverse perineal muscle. This one is superficial. And they all converge into this central tendon that the male also has, central tendon, or the perineal body. So notice that the external anal sphincter also converges in here, meaning by converge, I mean the muscles actually unite to form this area.